In this interview, we hear from Will. He's 26 years old, living in New York City. He's currently in his fourth year of dental school at NYU, so he has lots of great advice to share for anyone considering dentistry. Let's get started. Hi, Will. Thank you for joining me today.
Thanks for having me, Bridget.
So you are currently a dental student, and I am excited to talk to you about how you kind of came to figure out you wanted to be a dentist and what the process of being in grad school for that is like. So if you don't mind, can you kind of walk me through how you chose the path of dental school?
Oh boy. So it's a long story. I'll keep it as short as I can. I think it was like growing up, I had always wanted to do something in the health field. I know that my parents kind of pushed me down the whole like science, engineering, math type program studies. But I'd also really liked art. I'd always done it. I had a little bit of an angsty phase in high school where I told my mom I was going to art school, and she did not take too kindly to that, and I kind of had to reassess where I wanted to do with life. Although I feel like if I had a dream job, I'd probably be an art therapist on a coffee plantation in Hawaii, but that's,
Right.
think of that like down the line.
That's a cool alternative.
But like going through the whole like process of applying to colleges, I wanted to go somewhere where, I could, focus on the health fields and the sciences, but also have the freedom to do the arts on the side. So, as we both know, ended up at Binghamton University, where did both science and art. And I started out on the pre-med track. And, after a year or so, I was kind of, thinking, is this really what I want to do? Do I see myself in a hospital all the time? I had a lot of friends who were in the similar like career path as me who, always talked about how competitive it was, how you had to have perfect extracurriculars, all this research, a perfect MCAT score. And I was really thinking, like, is this really where I want to see myself? And not to mention that, at least from my perspective, I felt like a lot of the people were kind of unnecessarily cutthroat. And, I tried to do some soul searching after my freshman year of college and, think about other paths in the health field that weren't necessarily strictly medicine. And that's when I found, it's like, oh, what about dentistry? Because it was always in the back of my mind, but, nothing I kind of seriously considered up until I was like, I'm the, I guess, jump ship, if you will. Because, you can always like, the way I saw it is that, you get the satisfaction of, helping someone. I have a personal connection to it. Growing up, I had, braces, I had oral surgeries, a lot of things that really just drastically changed my smile and how I present myself. And, being able to give that back to others is something that, I really liked. And of course, you have the artistic hands-on side to it, which is probably my favorite part of the profession that I didn't see myself getting into with medicine as much. And now that I'm in my last year of dental school, I'm like, this was, in fact, the right choice.
It's good that you have the confidence in it now that you're almost at the finish line, right? So can you go into a little bit more of how dentistry brings in like an artistic aspect? I'm assuming that has something to do with the aesthetic of a smile, but I feel like people wouldn't necessarily describe it the way that you did. So I thought that was really interesting.
I guess the simplest way to put it is that when you're, fixing someone's smile, say like they come in, they chip their tooth, and, it's up to you to kind of sculpt it back together.
Gotcha.
If someone wants veneers, like you need to, plan out like how things align, and, you incorporate the whole artistic aesthetic component that way.
That's pretty cool. I like how you describe that. So I typically try not to like dive into too much of my past experiences with the interviewee, but can you please just talk about that time we were in a sculpture class together and why you had to take sculpture for your pre-dental track? Yeah.
I went to pre-health advising, and they said, like for dentistry, it looks good if you have like at least one sculpture class on it because, you're working with your hands. We had to make like a mock-up. Do you remember when we like built like something out of clay and then we had to carve it into wood?
Yes.
I guess like the big takeaway from that is, you know, when we built it out of clay and then we had to, you know, put it into the final product in wood, you know, at least like for what I'm doing and with dentistry, when, you know, someone comes in and they, you know, say they want crowns or veneers, like you need to, you know, take an impression, you need to file down the teeth, you need to, you know, sort of plan for how you want things to look afterwards. And, you know, there's, you know, we can build things up on a stone model with wax or with like a composite filling, and then kind of translate that into a final product. So, you know, like at the end of the day, even though that class was, you know, there's like a lot that I took away from it that's, you know, applicable to what I'm doing now.
That's pretty cool. Yeah, thank you for diving back into that blast from the past with me. So for students who are looking to, I guess, round out their application to go to their graduate program, are there any extracurriculars or steps they should take to kind of beef up their application or resume, essentially?
Yeah, definitely. You know, for any graduate health profession, you know, especially dentistry, you know, they want to see that you're a well-rounded student. So aside from the required science courses that, you know, most students are taking, you know, I also took a lot of classes in the arts. Like I had a double major in studio art. So it kind of set me apart from other applicants that were applying that didn't have the same, you know, background. And it was also a good conversation starter at interviews. You know, aside from academics, I, you know, did a bunch of extracurricular activities where, you know, I worked in sort of a team setting. So, you know, we were both tour guides, we were both RAs. So we had good leadership and communication skills that, you know, really translate well into working with patients. You know, I also did research as well because, you know, a lot of what we're learning right now in dentistry, not just in what I'm doing in school, but with other graduate health education programs, they really want you to stay current and up to date with the literature. So, you know, having a research background really helps. And most importantly, they want you to have firsthand experience in the field that you're going into. Shocking that it must be said, but being able to shadow, you know, a dental office or going into a hospital to shadow there is also, you know, super beneficial. And plus you can usually get a good letter of recommendation. And, you know, I was always asking, what did you do to help prepare yourself for school? Or, you know, what are some things that I'm going to need to look forward to? Or, you know, just can you give me some pointers here and there? And you know, it's really served me well so far.
That's great. You mentioned working with patients. Is there a specific personality that you feel does well in dental school? Because it's not just, you know, hard science. Like you're getting up and personal in people's faces. So I would imagine you have to have a comfort level making small talk at least.
Yeah, that's, you know, it takes a certain kind of person to really work with patients. And, you know, people always say, like, you can probably fill up most dental schools with people that have perfect standardized test scores and perfect GPAs, but are they going to have the people skills? And, you know, some of them might, some of them might not. Like, I'll be the first to say I had far from a perfect GPA and far from perfect DAT score, but you know, I think that most patients really appreciate when you're honest with them and, you know, they want you to communicate with them in a way that they understand. So, you know, we learned a bunch of like fancy terminology for procedures or materials, and then patients are like, huh, like, what's that? So you need to be able to kind of relate to them. And I think that, you know, having a, you know, that mutual respect and confidence in yourself really plays well without, you know, you don't want to be too arrogant either, because no one likes a doctor that's like, no, you're wrong. Like, this is right. Because there have been times when it's frustrating when, you know, a patient will come in saying one thing, and then after your assessment, you're 100% sure that, no, like, you made some points, but it's actually this. You need to have, you know, you need to have a good and effective way of communicating with them and kind of, you know, relaying back and forth what you found.
Right. Very cool. Yeah, I don't, I'm just like, while you're talking, I'm like thinking about all my dental experience. My favorite is when the dental hygienists try to make conversation and they're
Oh,
like,
you're like,
you're like, yeah, yeah, yeah.
yeah, thumbs up, we're good. And I'm like
Um,
watching the TV from the other side of the room, like what's on Food Network now.
yes, yes. Well, because you're in school and right now, you know, your career as a dental student, this is going to be a very broad question, I'm sure, but is there a specific stereotype or thought about each year of dental school? Maybe start off with like how many years you have to do.
So, you know, it's every program, it's no matter where you go, it's going to be a 4-year program. And, you know, speaking from my experiences at NYU, your first year, you know, it's a very didactic heavy. So you're taking a lot of the science classes, anatomy, physiology, and whatnot. And then your second year, well, also in your first year, you kind of do your, you know, your preclinical lab start where, you know, you get to take a drill and work on plastic teeth, but you're just doing like, I know, right? Like simple, like cavities on, you know, 1 or 2 teeth. And then in your second year, you know, you continue with the science classes, but then you kind of branch into, you know, the pathology of different dental diseases. And then you also get a little taste of each of the dental specialties. And then you're still doing your preclinical lab skills, but instead of just doing, you know, we call it operative work. So like, you know, someone comes in with a cavity, that's like an operative procedure.
Okay.
Your second year, at least from what we were doing, it was more of the prosthetic experiences. So like working on crowns, bridges, veneers, what have you. And also dentures, which, whew, not my favorite.
No, are they tough?
It's, I wouldn't say tough, but, you know, it's, at least for me, I think that, you know, when you are building a wax model and you're trying to set plastic teeth and you want everything to be like perfectly aligned, you know, maybe it's just us having the artistic background, but, you know, the eye for detail can sometimes be like, oh, no, this is like slightly off.
Right.
That was my second year. You know, they really work you with those classes, but, you know, it prepares you for your licensure exams and your boards. So then once you get to your third year, you're really focusing on treating patients in the clinic, and then you're also doing a set of rotations throughout all of the specialty departments. So you'll be, you know, in oral surgery assisting, you'll be in pediatrics assisting. You know, it's makes you more of a well-rounded type of student. So at the end of the day, if you so choose to specialize, you kind of know what to expect in each of the fields. And then again, you're us in fourth year. Obviously, some things have changed due to COVID, but right now it's like strictly just patient care. And, you know, they're just like, all right, kind of dive right into it. But, you know, it's good. I feel like I am more confident in my abilities now than I was, you know, 6 months ago. And I'm pretty sure that I will make it out in time.
I mean, it's almost lucky in a way, I guess, if you want to take a positive spin on still being in school while COVID is happening, because the dental experience from the patient side and from the doctor side is just so different than what it was prior to COVID. For anyone watching that has been to the dentist recently, it's a show. So
Yeah, I think I have let me grab my N95 mask.
okay.
Yeah.
Yeah, okay. It's just, so I guess in a way, it might be helpful to get that experience while you're still in school and like the world is trying to figure out how to do this for your career field, rather than being in the midst of a practice, being a practicing professional, being
Yeah.
like, oh my God, what is happening?
Because I think that, you know, like we're all still learning it together.
Yeah.
And, you know, I think that we know as much as, you know, any private practice office knows.
Yeah.
I guess, like, you know, for right now, it's more or less the same with some building occupancy restrictions, but we have, you know, we have like yellow gowns that we wear, we have face shields, we, you know, double mask up. Obviously there are gloves, you know.
Yeah, the whole 9 yards. So kind of going back to your discussion about your third year in rotations, did you get an understanding yet of any specialization you might be interested in, or if you want to work pediatrics? Because I feel like working with children will be very different than working with adults.
So, you know, I mean, on all of the rotations, like I thought coming into dental school, I wanted to do endodontics, which is where you specialize in root canals. I don't know. I always thought it was like
You're so cruel.
No. I just thought the whole process of, you know, going in and doing the
do what you gotta do.
But then, like, you know, going on my rotation, I was like, it just, you know, for me, I just didn't enjoy it as much. And I was like, all right, well, you know, the more you know now. And, you know, going in, I was like, I do not like kids. I cannot stand them. I will not work with them. I was a lifeguard. Like I was like a professional babysitter at times.
You got to know it. You can't work with kids if you don't have that inclination.
But we also had a number of offsite pediatric rotations where we'd go into like local like preschools and, you know, daycare organizations and do like dental screenings, or we'd put like fluoride on kids' teeth. And I think that one of the moments that sold it for me was at one of the schools that we were at, there's a lot of special needs students there. And so, you know, they would bring students in like one or two at a time so they wouldn't be, you know, overwhelmed with a bunch of students there and like our gowns trying to
sensory overload.
Exactly. And then there was I guess one of the teachers said, you know, we have one last student and, you know, they're very difficult, so if you don't like feel comfortable working with them, then, you know, we can always get one of the pediatric residents. Obviously they have more experience to, you know, treat the kid. And I was like, that's fine, like I don't mind, like I still need to do like one more patient screening and one more, you know, fluoride for my requirements, so I can do it. But, you know, if things get out of hand, then obviously like you can take over if something happens. And I don't know what happened, but the kid just ran straight up to me and gave me like the biggest hug, and I was like, oh my god. And, you know, we do this thing where we have to kind of like demonstrate to them like what we're doing, like how to like brush, and like we're gonna use this magic brush and paint your teeth and it tastes like raspberries. And the kid had a I think it was like a stuffed it was a stuffed animal. I don't remember which one it was, but we were using it to like demonstrate. And it was just like so heartwarming, and I'm like, oh my gosh, like if I can do this with and like I got like the biggest hug from the kid afterwards, and it's like if I can do that with someone that was, you know, quote unquote difficult, like I kind of like this, you know. So I guess maybe down the line I could see myself doing pediatrics, but, you know, as of right now I'm choosing not to specialize, and I'm just going into a general practice residency, which, you know, I need for my New York licensure. But, you know, like I'm not closing the door to anything down the line. It just, you know, for now, like I'm happy doing a little bit of everything where I'm not where I'm not committed to doing, you know, say just root canals or just oral surgery or just pediatrics, but I think I can do a little bit of everything, and then if I so choose, I can, you know, go back and specialize down the line, which is, you know, something that sets dentistry apart from a lot of other medical professions. You know, especially like with medicine itself, where after you finish med school, you apply for a residency and, you know, like you stick with it, versus dentistry, like say you go out, you get more real world experience, and then you're like, okay, I really found that I like this, but I don't like that. You can kind of pick and choose your path more down the line.
Very cool. And are there different, this might seem like a silly question and like I should know it as like an adult human, but are there different types of work environments you can choose to go into? Like right out of school, go work for a private practice, or down the line, opening your own practice?
I mean, as far as like practice ownership goes, I mean, I definitely see myself, in a private practice setting. That's not to say that there aren't other options, like other than your typical dental office.
Mm-hmm.
There are a number of dental service organizations, which are kind of like the chain offices where, like there are paths to ownership with those, but it's more or less like they're franchised out and then you're kind of like working for them.
Mm-hmm.
So that's one option. They usually have some pretty good sign-on bonuses for recent grads, which, it makes it a compelling option.
Mm-hmm.
I also see myself going back and teaching, whether it be, at NYU or any other dental school, maybe down the line as like a clinical instructor. Because some of my, when we're working on patients, obviously like we can't just be like, okay, we did our job, you're good. We have to obviously get it checked by faculty members that have their license and have been practicing.
Mm-hmm.
So I found that some of my favorite instructors have been, recent grads that to sort of mentor you through the process is really, I really appreciate that. And, I think I could see myself giving back that way as well.
I think that we've covered a lot, and I would love if we could wrap up, maybe if you have any advice for people who maybe are even in high school still haven't hit that college age if they choose to go. Any advice about how to get into dentistry?
I say I'm just gonna say like keep your options open and don't get discouraged. I think something, like being persistent and having that mentality where, you see yourself in the field really helps. I know coming out of high school, we both went to like really good university, and then, it was kind of a shock. I mean, at least for me, when I was like, whoa, I actually need to work hard to get A's. Like, what is this? Like high school, I was like coasting by with like 95 and above. And then college, I got like, a C in organic chemistry. And I'm like, I passed, like, that's all I need. But I think that, a big thing to keep in mind is just trying to be well-rounded because, at the end of the day, like numbers and GPAs and whatnot are important, but it's really how you present yourself and what you make of your experiences outside of school. Obviously, I never pressured myself into, getting into dentistry. After I graduated, I stayed an extra year to get my master's, and, that allowed me to tack on some more leadership skills on my resume, more clinical experience outside of school, definitely bump my GPA up, and it's like, oh, like you're capable of doing graduate level coursework. So it's definitely common for people to take at least one gap year between undergrad and starting, dental school, med school, what have you. So there is absolutely no rush. I thought starting, dental school at 23, I was going to be so far behind because I'm like, oh my gosh, like, people are coming in right out of college. And then, there are people that are my friends in my cohort that had other careers, or, like one of my friends, she used to be an engineer and she's in her 40s and she has 2 kids that are both teenagers. And it's like, she made the career change from like a successful engineering job. And she's like, nope, I don't want to do this. I want to do this now. So it's like, you really run the full spectrum of people that are in these programs. And I think that just like reassuring yourself that, if you really want it, it will work out in the end, just keep that mentality.
Awesome. Well, thank you so much. I think that gave a really great perspective of what it's like to be a dental student. And when do you graduate?
I, fingers crossed, graduate in May.
Oh, almost there. The finish line is in sight. Awesome. Well, thank you so much. Best of luck, and I'll talk to you soon.
Bridget.
Bye.